So switching gears from upper extremity to that of the lower extremity, right? When we're looking at this here, these are some of the muscles which act on the femur, or kind of that big thigh bone that we learned about. Excuse me. Now, there's a muscle called iliopsoas, right? The P is silent, so why is it in there? I don't know. There's so much stuff I question in the English language. Really, I'm actually teaching my kids how to read. I just don't get half the stuff. But you know what? I'm digressing. The iliopsoas is actually a combination of two different muscles, right? There's the iliacus muscle, which you see right in through here, right? That actually attaches to what's called the iliac fossa, And there's the psoas major. Psoas major attaches to a number of different parts on the lumbar spine, transverse process, a little bit of the body, right? But it too comes down. We see it right here, psoas major here. See, iliac is here. Maybe it's a little better seen here. And the two combine. Now, as they exit the pelvic cavity right here, that's where they are, the iliopsoas. And then extends down and attaches to the lesser tubercle of the humerus. Lesser tubercle of the humerus. Yep, that's a good one. Attaches to the lesser trochanter of the femur. Now, this is one of your major hip flexors, right? Hip flexor is if you were to, let's say if you're standing up, if you were to then take your, whichever leg you want, and pick your thigh up to bring your knee up like towards your chest, right? That's hip flexion, right? This is the muscle which predominates for that motion. This is the primary mover for that particular function. And this is also one of the muscles that we see a significant amount of problem. Let's say somebody who has some sort of lumbar radiculopathy, meaning if they have some sort of lumbar nerve, spinal nerve issue. This is where, like in the office, doing a neuro assessment, if you ask somebody to pick their leg up off of the table, and if they exhibited a great deal of weakness, that's indicative of that. Excuse me. That's one of the problems which might be present in somebody who has some sort of lumbar, again, radiculopathy, neuropathy, some sort of lumbar spinal nerve issue. Something else that this muscle can do. So this muscle flexes the hip, right? Bends the hip. A little while ago, and I talked in one of the previous videos when I talked about, the old school kind of sit-ups where they used to measure, how many can you do in a minute in elementary school? I don't know if they still do that anymore. I hope not. But this is actually the primary muscle that you're utilizing when you do a good old-fashioned, an old school sit-up. It's not your actual abdominal muscle. It's this muscle. It's your hip flexors. Now you think, well, hip flexors, how the hell do my hip flexors bend my torso? Well, think of it. If this is meant to flex the hip, if I fix my foot, if I nailed my foot to the floor, I can't flex my hip. So if my foot can't move, well, think about it. This muscle attaches to two sides, or two ends, over here at the femur and way up here in the pelvis. If I affix the femur so it can't move, the pelvis can still move. That's why if you think about the motion that you'd be performing, it's kind of bending over, right? Or kind of the old school sit-up. That's what you'd actually be performing, right? So that's why it can achieve that motion. And that's something else I really haven't mentioned too much, right? There are so many different muscles which can do so many different functions, and really a lot of them do kind of carry over or do very similar functions. Those muscles which kind of coincide or function for a similar movement, right? That's an agonist. Those are muscles which are trying to function for this. They have a common goal in mind. An antagonist is the opposite. The biceps brachii, which bends the elbow, that's an antagonist to the triceps brachii, which functions to straighten the elbow, right? So there's so many different muscles which can, again, perform similar functions. Right, again, iliacus, psoas major, for instance. A little bit later, we'll look at sartorius, for instance. It's not a super strong muscle, but it too can help to flex the hip. So here's just an individual picture of psoas major, right? Just an individual picture we can see here. This is psoas minor. Psoas minor. This is a very, it's very small, very thin muscle. It actually lies directly on top of the psoas major. Right, psoas major is much larger and it lies right here beneath it. Here beneath it. Psoas minor lies directly on top of it. You can see it's mainly tendon. Right here. Now here is a gluteus maximus. Gluteus maximus. You can see the gluteus maximus. Again, look at the kind of the fiber orientation like this. So when we think about what it is going to do, it functions for hip extension, meaning if you were standing up and think about taking your hip and pushing it, taking your hip and taking your heel and pushing it back into the wall, that's extension. Right. It also is going to take and perform what's called external rotation of the hip. So imagine if you were taking your foot, right? Let's say you take your right foot and turn it so your toes go outwards. That's external rotation of the hip. Right. I actually had to stand up as I'm doing these, and I just realized I don't know why. You can't actually see me. That's okay. But that's external rotation of the hip. This here, right, this is an actual, right, the gluteus maximus, the gluteus muscles are actually a group of 3 muscles, right? Here's a gluteus maximus. I couldn't find a cadaveric model that was particularly good, so that's why we got the good old-fashioned, hand-drawn ones. It's still very good, though. Here you can see gluteus maximus, right? Gluteus maximus here. On this image, you can see gluteus medius, right? See up here a little bit, right up and through here. Gluteus medius really deals much more, again, right through here, really deals much more with abduction of the hip or of the thigh, right? So let's say if it was the left gluteus medius, think of the left gluteus medius actually takes the leg or takes the thigh and moves it away from the other hip or the other thigh, excuse me. Gluteus minimus, again, much smaller, much deeper. Right? If you take gluteus maximus, you have to pull it off. You then have to take gluteus medius, pull it off. Then you expose gluteus minimus. Again, gluteus minimus comes down, attaches to the greater trochanter. Gluteus minimus does a small amount of external rotation. There's a small amount of abduction. Really, by and large, it's kind of a stabilizer of the hip. Right? Piriformis muscle. This guy right here. Piriformis muscle performs external rotation of the hip. So again, if we're standing up, think about taking your foot and turning it outwards, right? That is the piriformis muscle, which is helping to cause that. Right, piriformis muscle, again, that's the kind of, I say, the waddler's muscle, right? Women who are pregnant. When they get, my wife, when she had the twins, she was glowing and large and beautiful, but she had this waddle, right, at around 8 months. And the reason why, right, when I say that waddle, that pregnancy waddle, where the toes are kind of, where the feet are kind of toeing outwards. Well, as the feet are toeing outwards, well, think of it, that's external rotation of the hip. All right, so that's really the piriformis is the primary, responder for that. But this muscle comes and attaches to the, again, greater trochanter, also attaches to the sacrum. But one thing about that is the SI joint, this joint right in through here between the sacrum and the iliac bone here. That is relaxed later on in pregnancy, right? Junior has to grow. These various hip joints have to begin to, move to a greater degree in order to permit Junior, right, in order to permit Junior through the birthing canal, in order to permit Junior to actually grow. So there's a hormone called relaxin, which is released, which actually does permit these muscles to relax and actually puts a little bit of laxity into the joints themselves. So in order for the muscle to, or in order for the joint to remain as stable as possible, the muscles themselves actually have to tighten up to stabilize? Well, the piriformis is one of those muscles. So as it contracts or tightens, it takes the foot, turns it outwards, it externally rotates the hip. Right, so that's why we get that kind of waddling or that kind of toeing out appearance. That's meant to help stabilize the SI joint or the sacroiliac joint. When we start to look at the anterior part of the thigh, there's a muscle called TFL, tensor fasciolata. Tensor fasciolata. Again, it comes up and it attaches just behind what's called the ASIS, the anterior superior iliac spine, really just along the anterior portion of the iliac crest. As it comes down, it actually inserts onto the IT band or the iliotibial band or the iliotibial tract. If you've ever heard of runner's knee, right, it's pain kind of felt down here on the lateral aspect of the knee, right? That's something called IT band syndrome, or again, runner's knee, right? The IT band is meant to help stabilize both the knee and the hip. The TFL, tensor fasciolata, its purpose is to help kind of tense and tighten up that IT band to help stabilize the knee. Right in through here. Here, the quadriceps femoris muscle. Now, the quadriceps femoris muscle, quad, forceps, head, right, femoris, it's a four-headed muscle which kind of hunkers itself along the femur. Here, we can only actually see 3 of the heads, and in actuality, there's actually 6 heads, but the other 2 heads are a little less important, don't deal with so much movement of the knee or the hip as opposed to get certain tissues in position to allow for the adequate movement, right? So we're looking at this, there we go, this here, right? This here is the rectus femoris. This here is rectus femoris, and let me draw. Woo! A little Saturday Night Palsy going on. Good Lord. Right there. That's rectus femoris. Right. This muscle here, right here, that is vastus medialis. And then this right here, again, that is vastus lateralis. Right, so vastus lateralis, vastus medialis, vastus, let's try that one again. Vastus lateralis, rectus femoris, and then vastus medialis. Right, vastus intermedius, in order to see that, you've actually got to tear off rectus femoris, and then beneath it, right, or behind it, that's where you actually see vastus intermedius. The next muscle, right here, something called sartorius. It's a thin muscle, a thin, strappy little muscle. Right, you can see it attaches just inferior to the ASIS, right, and the pelvic bones, and it extends, and you can see it wraps around the inside portion of the thigh. It comes all the way down and attaches just to the inferior side of the tibial plateau, as well as the medial portion of the tibial tuberosity right here. That's going to function to do, well, okay, it crosses the hip joint, and it comes down and it crosses the knee. Right, so it's going to function to flex the hip, as well as flex the knee, as well as perform lateral rotation of the hip. So it does a number of different functions. Right, it does a number of different functions. By and large, when these muscles that are kind of this long but that kind of thin, they generally don't perform a huge amount of movement. They're generally more of kind of stabilizing muscle. This is something called adductor brevis. Adductor brevis. Adductor brevis. Again, adduction, the adductor group. Right. Think about if I take your legs, spread them apart, and then if you take the muscles or if you take your legs and then move them together, that motion is adduction. So the muscles which help perform that are the adductor group. This one specifically here is called adductor brevis. adductor brevis. Just inferior to that is something called adductor magnus. Adductor magnus, right here. Adductor magnus. Now, when we look at this, right? If I look, for instance, look at this image here, kind of right in through here. If I back up, ooh, that looks way different. Yep. In order to see adductor magnus and adductor brevis, we have to remove a couple of the overlying muscles. The first one is adductor longus. That's got to be removed. If that's not removed, we can't see deep to it, or we can't actually see behind it. So this is adductor longus. And beside that is something called pectineus. Pectineus. And again, you'll notice a number of these adductor muscles, I am not talking about the different attachments and the origins insertions. I'm not talking about those because those are ones that, those are skeletal structures that we did not learn about. So it's not that they're not important, it's just that, you know what, got to draw the line somewhere. So those are specific structures we did not mention when we covered the skeletal system, hence the reason why I'm not mentioning them now. Another muscle, right, running along the inside portion of the thigh. That is something called gracilis. Something called gracilis. Again, a very thin, strappy muscle. Thin and strappy, kind of like sartorius, but it runs along the medial portion of the thigh. Now these here, these are a part of the hamstring. There's actually three muscles which make up the hamstring. There's biceps femoris. Right now, before we heard something called biceps brachii. The biceps brachii, that's the arm muscle, right? Think about like the whatever, when we do an elbow curl or a bicep curl, that's the bicep brachii. Bicep femoris, that is the bicep muscle which runs along the femur. That's part of the hamstrings. Now, when we come down, we see that the hamstrings attach to the ischiotuberosity. And they extend down and it attaches to the head of the fibula. Now there's two different heads of the biceps brachii. Again, I don't care that you know which head is which. Right. Just know that these are the bicep brachii. The biceps femoris, excuse me. Biceps femoris. The biceps femoris is on the lateral aspect of the thigh. It's not completely on the side of the thigh. However, when these muscles here are the other ones that make up the hamstrings. We'll point them out in just a second. So when we talk about the hamstrings, the biceps femoris is on the lateral side, or it's in the lateral group of them. It's not on the lateral side of the leg or lateral side of the thigh, if that makes sense. Functions of the biceps femoris. Again, that's going to function. Yeah, it helps stabilize the knee, but really what it does is it helps flex the knee. So imagine if you were going to take your heel and kind of kick yourself in the butt. That is flexion of the knee. Something else it's going to do is the hamstrings do perform a small amount of hip extension. Semimembranosus. There's three muscles: semitendinosus, which we'll talk about next, semimembranosus, and biceps femoris. Those are the three muscles which make up the hamstrings. We just covered biceps femoris here. Here is semimembranosus. Semimembranosus, we can see, is a kind of a thickened muscle all the way through here. And I say thickened, yeah, because when we compare it to that of semitendinosus, woo, much thinner. Right, and the other part of it is semitendinosus lies on top of semimembranosus. So we look at this. All right, here's biceps femoris. Cool. We can see membranosus a little bit here. kind of distant through here. That's semimembranosus. Tendinosus is this one here. So if I back up, before I do that, if I remove semitendinosus, because remember, semitendinosus lies on top. If I back up, now I can see the entirety of semimembranosus, but to do that, I had to remove semitendinosus. All right. The next muscle, again, really kind of very similar features to the forearm muscles, right, that we talked about in the previous video. These are kind of dealing with the toes, right? So whereas in the forearm muscles, it was the, dealing with the digits being the fingers, here in the foot, it's still digits, but it's the foot. So we have extensor digitorum longus, and you can see that is, right, this kind of yellowish thing here. This is the shin bone, or this is the tibia. Right, that's that kind of large, hard blade that sticks out in the front part of the leg, right here. This here, right, this is extensor digitorum longus. You can see it comes out and it attaches to fifth, fourth, third, and second digits. It does not attach to the big toe. Just like the thumb, which has its own group of pollicis muscles, the big toe has its own group of muscles called the hallucis muscles. Right, you can see some of those tendons here. This would be extensor hallucis longus, but again, we're not looking at the hallucis muscles. This here is extensor digitorum longus. Directly to the side, right? So if we kind of feel your tibia, that hard shin bone in the front part of the leg, and if you just kind of fall laterally or to the side of it, right towards the outside, you kind of start to feel this kind of soft muscle. That's the tibialis anterior. That literally hugs itself right along the side of the tibia. Right along the side of the tibia. When we talk about like the tibialis anterior, or when we talk about like shin splints, right? There are certain shin splints or pain from the front part of the leg, which can arise from like mini stress fractures and things like that. But when we talk about, for instance, more commonly, what can happen is, especially people who are not kind of well trained. Hey, I'm just getting out into running for the first time in a long time. This muscle can get significantly overworked, right? Because when we go for a jog, we can take thousands upon thousands of steps, and it's done at a pretty high rate. So this muscle can get significantly fatigued very quickly, and that, when you kind of think about a fatigued muscle, it starts to burn, then it starts to ache, and then it can become actually just kind of straight up painful, almost painful to walk on. Because the thing is about the tibialis anterior is it performs what's something called dorsiflexion, where you kind of think about taking your foot and pulling your toes up towards the sky. Right, that's the function of tibialis anterior. It does also perform what's called inversion, right? Inversion, taking the foot and inverting it, right? So that, again, those kind of motions are in conjunction with those motions of running. That's why this is one of those muscles which can be kind of confused with, or kind of be called shin splints. When we wrap around to the backside, right, or kind of look at the posterior aspect of the leg, this is a muscle called the gastrocnemius, or the calf muscle. Right, this is the calf muscle. When we think about the calf muscle, what does it do? All right, our calf muscle takes and lifts us up on our kind of the balls of our feet. How it does that, we see it attaches to the calcaneus, which is one of the main tarsal bones. And that's our heel bone, if you will. And the gastrocnemius comes all the way up and attaches to the condyles on the femur. Right, lateral medial condyles on the femur. So when that happens, really two functions. One is something called plantar flexion, which is where we go up on the toes. And then secondly, the gastrocnemius muscle also does do a small amount of knee flexion as well. Again, that is the the gastrocnemius muscle or the calf muscle. Look at this down here. That's the Achilles tendon. Right, Achilles tendon also be called the calcaneal tendon. The calcaneal tendon because it attaches to the calcaneus. Right, this is the calcaneus here. Gastrocnemius here. If I take the gastrocnemius and I remove it, now we expose a muscle called the soleus. A muscle called the soleus. The soleus, again, attaches throughout the tibia, throughout the fibula, and it also attaches to the calcaneus. So part of the soleus is, or the tendon of the soleus is a part of the Achilles tendon. But the soleus solely functions to perform plantar flexion. The other big thing is at the beginning of the very first video of the skeletal system, I mentioned how our skeletal muscles contribute to something called the skeletal pump. The soleus specifically is a hugely important muscle when it comes to the functioning of the skeletal pump. There are a number, think of it just gravity-wise, right? Our lower limbs have to push blood all the way, or that blood has to get all the way from our lower limbs, all the way up against gravity, all the way up back to the heart, out of the legs. So that's one of the things of the soleus, because underneath it there's a number of different veins. So as the soleus contracts, there's a number of different veins that constricts, and it helps propel that blood upwards towards the heart. Sticking with the backside of the calf, right, or the backside of the leg, excuse me, here's a muscle called flexor digitorum. Flexor digitorum. And you can see flexor digitorum wraps around the underside, and you can see it comes out, and it goes out and attaches to the second, third, fourth, and fifth digit. Now that's going to perform flexion of the toes. So if you took your toes and kind of drove them into the ground, yeah, that's flexion of the toes. It also does contribute to plantar flexion, right, going up onto the balls of your feet, but that's primarily gastrocnemius and soleus. That's going to perform that. This next muscle here, right, so we started on the front, wrapping around to the back, now we're wrapping around to the side. This muscle called the fibularis muscle, right? There's multiple different of these muscles, longus, brevis, tertius. We're just looking at longus and brevis here. You'll see how peroneus is in parentheses. Fibularis, longus brevis, or peroneus, longus brevis, totally up to you, right? These muscles, you can see, attach along, right, this lateral aspect of the fibula, right? And as they extend downwards, they wrap around the lateral malleolus, underside of the foot to come all the way across, attached to the first metatarsal, right? The first metatarsal here. And when we think about, right, the kind of motion that that's going to perform, whereas think if you've ever sprained your ankle, right? If you've ever turned your ankle in, that's something called inversion, right? The fibularis muscles do the opposite. They do something called eversion. They take the foot and kind of turn it outwards. Again, it's kind of an awkward motion. You really can't do too much of it. Right? You can do a lot less eversion than you can inversion. Right? So that's part of the reason why eversion ankle sprains are pretty uncommon. Right? 85+% of them are all inversion sprains. The other thing it's going to do, again, eversion, but also a small amount of plantar flexion. Right, but really that's a secondary. Its primary means is to perform eversion of the foot.